Safe and effective medical direction depends on a physician, PA, or nurse practitioner on the phone or radio knowing their providers and their scope of practice before they call in. Providing medical direction for emergency medical services makes a tremendous contribution to the community and the patients that you serve. The EMS providers in your community are on the front line in the provision of effective emergency medicine. In reality, they are your eyes, your hands, and your ears. Medical direction comes in two different forms: offline and online medical direction. Offline direction is providing support to educational programs, protocol development, and participation in quality improvement. In many ways, the time spent providing offline direction helps determine the quality and direction of your community's EMS system. It can also help you become familiar with the providers you interface with. Every New Hampshire EMS educational program must have a medical director of record. While most of the instruction may be provided by EMS instructors, effective medical direction can help assure the accuracy and quality of the material taught. The key to effective quality improvement activity is determining ways to improve outcomes. Closing the QI loop often depends on targeting continuing education towards the deficiencies identified in QI review. Your role as a medical director is important to help assure quality in education and focusing continuing education efforts based on the needs that you help identify. In many ways, good offline medical direction helps decrease the need for frequent online medical direction. The online direction you can provide can be critical for a variety of reasons. A provider calling to consult with you is not a sign of weakness. It is a sign they recognize the need for your help and expertise. In addition, there are many difficult situations that require your expertise to help them sort out. As mentioned in Unit 2, the most common reasons for a call-in are field refusals of care, field termination of a resuscitation, resolving protocol conflicts, or just not being sure about what to do and looking for your guidance. The best thing you can do is to be prepared. Take some time to become familiar with the New Hampshire protocols. It is important to understand the scope of practice for each level. Pages 120 through 125 have an excellent overview of the scope of practice. In order to have an effective relationship as a medical director, you need to know your providers, develop lines of communication, trust, and mutual respect. Your EMS providers will call in on the radio in stressful situations. In order to gain some clarity and understanding, use the communications loop to promote accuracy. Listen attentively. Repeat back what they just said and confirm it. Ask questions, listen, and repeat back what they just said to you. Issue any orders and ask them to repeat them back so you can confirm them. Keep a copy of the protocols near where you would normally answer the phone or radio. If you're unsure about a protocol, look it up. There may be situations that require a deviation from the protocols. However, these should be extremely rare. Deviation from the scope of practice just exposes you to additional risk.
Physicians sometimes have trouble understanding why EMS providers work by protocol. We physicians need to remember that even with our years of training, when we have to act fast, we perform best if we have well-established procedures and algorithms. That's why we have ACLS and ATLS. And that's why New Hampshire EMS providers have the New Hampshire Patient Care Protocols. This is the 2009-2010 edition. These protocols are prepared by the work of over 100 people, and they're continually updated. The new edition is coming out in 2011. These truly reflect the state of the art in EMS. In fact, 2 states and several smaller jurisdictions outside of New Hampshire have asked for permission to make our New Hampshire protocols their own. Studying these protocols is an excellent way for physicians to learn about EMS and to be ready for solid EMS leadership.